I love it.
Thank you so much, team. That's worked up an appetite. Now let's re-engage with the best of ourselves, because that's what we need to do in our current situation here in South Africa. Food Relief Organisation, an incredible group of people, Foodforward South Africa, believe that together we can create a South Africa without hunger. I get behind that. We know that food insecurity is a massive problem in our country, astounding the levels at the moment. And now more than ever during the pandemic, people are suffering and need a helping hand. Enter the Foodforward SA's Food Relief Initiative for Vulnerable Patients, a pilot project in partnership with Feed the Nation Foundation and the Western Cape Department of Health. Andy du Plessis, who is a wonderful human being and a good friend of the show, Managing Director of Foodforward SA, joins us now online to tell us a little bit more. Andy, great to see you again, my friend. How are you?
I'm very well, Graham. It's good to see you again. It's been a while, though.
It has been a while since we connected with you, but you haven't stopped doing the amazing work that you do on the ground. You've been very, very busy. But maybe let's start here. Paint a picture for us. What's the situation like where, when it comes to these food hampers that you've been busy with, where will they be handed out? Where have you been handing out food hampers?
Yeah, so as you know, under normal circumstances, our program actually reaches just over 1,000 registered non-profit organizations, and we provide them with a basket of food. And what they do in turn is they convert that food into meals so that people are able to receive a meal every single day. But what we found was, because millions of people have lost their jobs, between 5 and 6 million people have lost jobs in the last year, we found that more and more people were becoming food insecure. And so we wanted to focus more on healthier communities. And so we wanted to make sure that the most vulnerable in our communities, which are those suffering from COVID-19 that have lost the ability to earn an income, as well as those that have chronic illnesses that just won't allow them to work, that need to rebuild their immune systems so that they have the strength to look for work. But of greater concern for us was we didn't want those food parcels just to go to anyone. We needed a verification process in place. So we approached the Department of Health. I used to work in the Department of Health many years ago, and so I still know the people there, Dr. Keith Kluter, who heads up the health department, and the people that support him. And so we approached Dr. Kluter and his team, and we said that we have this initiative where we'd like to support COVID patients, as well as people with chronic illnesses in poor communities, so that they were able to receive a food parcel from us, a very healthy food parcel. But what we needed from the health department was that through the clinics, the nursing sisters and community dietitians when they do their screening of patients and they find that food insecurity is also a problem, that is where we want to step in. So what the health department does is all those clinics send the details through to one coordinator centrally at the health department. Once a week, we get those patients' names and addresses, and we deliver a food parcel which consists of a range of items, fruits and vegetables as well, directly to the patient's home, so that the family can have food at least for the next 3 to 4 weeks to help build the immune system.
Andy, this speaks to how far you've come in as an organization, the fact that you've got the strategic network to be able to employ at the moment. So kudos to you for taking it to this level now and including the nutrition based on the greatest need. But I've got to ask, because I'm working in this space, I've heard astounding numbers of the level of food insecurity and just how hard communities are being hit. How bad is the situation from your experience out on the ground? How desperate is the need at the moment?
Graham, I have to say that people are desperate. I mean, just think about this. I know many people where not only the husband or the breadwinner has lost their jobs, but also the wife, who may have also been a breadwinner. So overnight, both parents have lost their ability to earn an income. And that leaves people stressed out. People are panicking. They can't focus. It's difficult to find jobs in this environment. So the need out there is great. You go and look at the SASSA queues when it's paydays, and you look at the amount of people willing to come early in the mornings, long queues, desperate to receive that SASSA grant. That's the situation out there all across South Africa at the moment. So our focus is not only just to feed people. We have to make sure that we find the individuals and those families that are vulnerable at this time, so that our intervention takes place at the right time, so that people get food, the food they need to survive, that people have the strength to be able to go and look for work, and that we transform poor communities into healthy communities, because we're focusing on patients with COVID-19, and we're focusing on individuals that have chronic illnesses such as tuberculosis, HIV and AIDS, and other health illnesses, so that we rebuild our communities to become healthier communities. So these food parcels are going to targeted individuals to make sure that the most vulnerable individuals in the family. Keep in mind, we are not only reaching the individual or the breadwinner, that entire family is being fed. So a family where the child may only be, as you know, schools are closed right now, and so children aren't getting the school meal that they need. So it's crucial that we reach these homes so that school children are also able to benefit from this, so that children in early childhood development centers are also able to eat a meal, because children that do not get a meal cannot learn efficiently and optimally. And this is why it's so crucial that we ramp up and get food to those that need it at this time.
Well, it's totally heartbreaking to know that there are so many households and so many families
Nearly
who
half
are
of the population.
food insecure. I mean, to really go without food is such a terrible thing. And thank you very much, Andy du Plessis, Managing Director of Foodforward SA, for the wonderful work that you are doing together with the Feed the Nation Foundation. And of course, the Western Cape.
Thank you very much for having us.
Thank you. And the Western Cape Department of Health have also stepped in there. They really are part of this. They're helping to restore dignity to over 7,000 people. That's a lot of people, of course, who have been affected by COVID-19. It's a start.
It's a start, and it's also the knock-on effect that you're feeding the breadwinners, but you're also feeding their families and empowering the communities and helping to strengthen those bonds. Incredible work. Andy, we absolutely love you, my friend. Hopefully that's inspired you at home to think about where the country is right now and what you can do.